This informational video from the Johnson County Health Department Public Health Emergency Program was developed with funding provided by the Centers for Disease Control and Prevention Cooperative Agreement. The following footage and interviews were recorded during the 2011 Spring Fever Functional Full-Scale Anthrax-Based Exercise, April 18 through 20th, 2011. The following footage and interviews were recorded over a 3-day functional full-scale exercise in April 2011 and reflect the county-wide response, including warehouse management and supply distribution, emergency operations center departmental coordination, and mass dispensing activities. This video is an opportunity to review the various types of activities that the Johnson County Health Department is responsible for in an emergency, and what all Johnson County employees may be asked to do to support a public health emergency response. This video will start with a history of the Public Health Preparedness Program and end with a call to action for the new public health employee. It will also address several areas of emergency preparedness and public health response.
Our hope with this video is to educate all staff that they could be called at any time, reassigned to support the county in any kind of operation, whether it is our dispensing operation or it is in a county-wide emergency and opening a shelter or providing any type of emergency support to our citizens.
In the event of a county-wide disaster or public health emergency, all Johnson County Health Department staff may be called upon to respond in different ways. Some of you may have a pre-assigned role in our incident command system. Some of you may be asked to go in the field and conduct assessments or support a shelter. Some of you may only be called upon if we are conducting mass dispensing or vaccination operations. All public health staff are subject to reassignment for assisting or responding to an emergency based upon need. A public health emergency is when an imminent threat of an illness or health condition believed to be caused by bioterrorism, a new or previously controlled infectious disease, a natural disaster, a chemical release or attack, or a nuclear attack or accident poses a high incidence of harm to a population, including possible severe illness and death. Examples of public health emergencies include such things as an anthrax attack, a new flu virus, or a communicable disease with severe effects. A public health emergency is declared when the consequences of an event have the potential to overwhelm the community's ability to address them. One week after the terror attacks of 9/11, this country was faced with another threat, a real and tangible threat of bioterrorism. Not only did those anthrax letters kill 5 and sicken over a dozen more, it highlighted the lack of bioterrorism preparedness in this country at every level, from the CDC to local public health departments, from state public health to emergency responders and communities at large. There was a lack of understanding of the need, the resources, and the expectations related to this type of response.
The United States was not as prepared for an act of terrorism such as bioterrorism in the anthrax letters and the white powders that we had. And because of that the response was what it was based on the resources we had. Congress said we need to have local public health, local government better prepared to respond to such an incident as this, and have provided funding to local agencies as well as state health departments since 2002.
The main goal of the Public Health Emergency Preparedness, or PHEP program, is to plan for the county-wide response to an act of bioterrorism such as we have never seen. What if every person in the Kansas City area was exposed to anthrax? What would we do? How would we take care of these people? When and how would we get the supplies we would need? These are only a few of the planning focus areas and questions that PHEP tries to answer with pre-planning, training, and exercise. Basic plans require the following: a command and control point, our Health Departmental Operations Center, or DOC, a way to clearly organize the large number of responders, the Incident Command System, or ICS, and a central coordination point for all county resources, the Emergency Operations Center, or EOC. Combine all of those, and you will start to see the complexity of planning, training, and exercise that PHEP manages. Regardless of the type of incident, One of the first actions the health department will take will be to open the Departmental Operations Center or establish a command post, as dictated by the needs of the incident. It is the Johnson County Health Department's responsibility to direct and coordinate the activities of JCHD staff towards public health-related objectives in an emergency. Whether that is post-disaster child care facility inspections or just providing technical expertise, the DOC's role is to identify objectives, assign and request needed staff, and plan for future actions.
The Departmental Operations Center takes care of planning everything that happens. We try to take into consideration contingency plans, what supplies we'll need. We would be constantly in touch with the Emergency Operations Center, where the county manager and the emergency management would be, and interfacing with them, letting them know what our needs were, feeding information to them about what's going on. Today's situation, we would be concerned about throughput numbers, how many people we've actually seen, how quickly are we seeing them.
In the event of a disaster, the Johnson County Health Department, Departmental Operations Center, or DOC, staffed by pre-identified public health personnel, would be activated to organize and coordinate the health department's response to the given situation. Everything from shelter support to mass dispensing assignments. The DOC is the centralized command area where the Public Health Incident Commander, along with command and general staff, coordinate public health response operations in conjunction with the Johnson County Emergency Operations Center. Providing leadership and direction is a key component in our emergency preparedness planning.
Okay, well, we just had our briefing.
The role of the Emergency Operations Center, often called the EOC, is to bring together relevant disaster information in one central location, organize and present that information in a useful way to the decision makers, and facilitate the coordination of resources required to meet the needs generated by the emergency or disaster situation.
The Emergency Operations Center does consequence management. So anything that could cause a large-scale emergency beyond the capability of one of our cities to handle internally could cause the Emergency Operations Center to open. So for example, if we have a public health emergency, if we have a terrorism event, if we have a major flood, then we use it to coordinate a response.
The Johnson County EOC provides primary coordination and control over countywide events, including the unincorporated portions of the county. The EOC provides assistance and resources as requested and serves as the single point of contact and coordination for resources and assistance from the state and federal levels of government. The purpose of the EOC is to assist in managing disaster response efforts quickly and effectively. In its simplest form, an EOC ensures that necessary tasks are identified and successfully completed in a timely manner towards disaster response. In the event of a disaster or emergency where medication and medical supplies are needed, the health department and other county partners will be called upon to help manage one of the major areas of focus for the Public Health Emergency Program. The Strategic National Stockpile, or SNS, has large quantities of medicine and medical supplies stockpiled across the country available to states and local entities if there is a public health emergency, such as a terrorist attack, flu outbreak, or natural disaster severe enough to cause local supplies to run out. Once federal and local authorities agree that SNS is needed, materials will be delivered to any state in the U.S. within 12 hours or less. SNS asset deployment must be based on evidence of a national emergency. To receive assets, the governor will request deployment of SNS supplies from the Centers for Disease Control, who will then decide upon a course of action. Upon receiving the shipment of supplies, the county is required to sign for and agree to take responsibility for the materials. The SNS is a federal resource that public health can utilize in an emergency. We are tasked with dispensing this resource of medication and medical supplies to our community in an emergency and partner with many entities to meet that goal. Medical supply management and distribution is just one of the many roles of the health department in a disaster.
The facilities department has worked with the public health department for the last couple years. Since we are experienced in warehousing and logistics, we were asked to help them disseminate the medication to the sites around the county. We receive the assets, break them down, and then dispense them to the different sites.
Federal planning requirements dictate that, in some instances, we may need to dispense medicine to all Johnson County citizens within 48 hours or less. Instances such as these would require help from all Johnson County Health Department staff and assistance from other Johnson County government agencies. If medicine is available locally or through the SNS, first responders to the event, including Health Department staff, their family members, and other supporting agencies, may receive medication before dispensing to the general public.
Our goal is to set up 8 of these locations across the county to dispense medications in 48 hours or less to all residents and any visitors that we have. We would do this for any type of disease where we had a medical countermeasure to provide.
Our goal is to provide needed medication to Johnson County citizens within 48 hours or less during a public health emergency. Your emergency training and exercise participation is key to helping you become familiar and comfortable with your emergency response role.
ICS stands for the Incident Command System, and that is the system that we put in place that allows us to manage incidents. And it's a modular system. We can apply it, put it in place on fairly short notice, and expand it and contract it as the situation dictates. The Incident Command System brings order to any type of incident at any location.
Federal standards require first response agencies to implement the Incident Command System, or ICS, as a foundation for emergency response. The Johnson County Health Department, just like other response entities, utilizes ICS in order to have a more coordinated response with other city, county, regional, state, and federal agencies. Your ICS position may or may not be related to your usual work activities. In many situations, most of you will be notified of your ICS position at the time of the emergency, and just-in-time training will be provided.
There's a lot of players involved, and one of the most important things that I believe is having a command structure. I like knowing who I have to answer to. I like getting information from one person. What I suggest in any of these events is to keep communication in that direct line. You can see we all get excited from time to time, and when something goes wrong, you have 10 people asking the same question at the same time. It's always, one of my best advices is it's always best to back up, stay calm, and regain control of that chain of command so you know what questions are asked and asked of who.
There are those in the health department who have a permanent ICS position because of their day-to-day job function and availability. Those people require extra training and would be called upon more frequently than others to respond. We are a county agency and may be asked to help in a county emergency, assisting with shelter operations, providing technical assistance, or conducting mass dispensing. No matter the task, we will be there to assist as needed. And in a public health emergency, various county agencies will be there to help us in any way possible.
It's important to exercise with other county agencies and jurisdictions because we've developed a regional, state, and national level emergency response system that requires us to access all the resources of the county to respond, and then to be able to coordinate with the state and federal government. And if we don't practice that response, in the case of a real emergency, we won't be able to respond as effectively.
It is important to remember that county response is a partnership, that in a public health emergency, the health department would be the lead agency because we have the technical expertise to do the job that needs to be done. But we will also need the support of the community as well as other county agencies to provide support and overall coordination of the effort that's necessary for response operations to come together effectively.
It's important for every new employee of Johnson County Health Department to be familiar with the organization's emergency response plans, to have a good understanding of the incident command system, and also to know what their potential role would be in the department for responding to an emergency.
One of the pieces of advice that I would offer to somebody who's new to disaster response is an old saying within emergency medical services, and that is to take your own pulse first. To take a deep breath, collect your thoughts, and then to proceed forward, and you'll do great.
The advice I would give new public health employees is to be ready. In today's day and age, every employee is a community emergency response provider. So in the event of an emergency, all personnel in Johnson County can be redirected to respond and help the community, and the citizens expect that. So be prepared for that. Understand that we're all part of a larger system and that our cooperation and our efforts are needed and expected by the community.
Interdepartmental and interagency support is crucial in all aspects of emergency response. Your active participation in training and exercise at JCHD is critical to the county's continued goal of being a community prepared. If you are ready, we are ready.